what is your challenge statement with your focus?
It would be bloody epic made that by April 15, 2017, all Memphis ED staff and lab personnel use the best lab draw technique and equipment to collect blood draw specimens, and this technique is standardized across all staff and shifts. And our patients perceive blood draw comfort and nurse technical skills are at very high levels, so that we achieve outcome metrics of less than 2% of all ED specimens drawn are hemolyzed and greater than 94% press gaining technical skills score and blood draw comfort score. Our focus is equipment utilized for blood draw.
What is the target condition?
Target condition is that orders are placed, lab labels printed and retrieved, standard supplies collected to obtain labs, explain the procedure, assemble equipment, apply tourniquet, find site and prep with antiseptic, antiseptic dry time, insert needle, collect blood specimens in order with proper inversion technique, tourniquet release, dressing applied, lab labels applied properly on tubes, ID band and lab label scanned, document actual collection time, specimens to lab via tube station or walked. Process characteristics are the blue transfer device with INT draws, the red transfer device with syringe draws, IV catheter size 20 gauge or greater, determine optimal IV extension or connector, clear tube waste, optimal chemistry tubes, process metrics of a hemolyzed specimens resulting in recollection 5.75%, reduced cost of recollection by 3.13%, outcome metrics a total hemolysis rate in the ED of 4.5%, press gaining technical score of 95%, and press gaining patient comfort score of 90%.
In your current condition, what is your actual condition now?
Current condition is that patient condition meets blood draw need, various supplies obtained to draw specimens based on individual preference and stock availability, lab labels are printed, explain the procedure, assemble equipment, apply tourniquet, site selected and prepped with antiseptic, antiseptic dry time varies, insert needle, rainbow set drawn, filling tubes to capacity, order of draw and inversion tubes vary, tourniquet released, dressing applied, lab labels applied, ID band and lab labels scanned with some variation, and specimens to lab via tube station or walked. Process characteristics are the blue transfer device availability, red transfer device access is limited, IV catheter size varies, utilizing IV extension set or connector with INT draw, gold top is waste, dark green versus light green tubes. Process metrics are the hemolyzed specimens resulting in recollection 5.65% as of March 17, and reduced cost of recollection by 3.13%, or 3.37%. Outcome metrics are total hemolysis rate in the ED of 4.03%, press gaining technical score of 85.7%, press gaining patient comfort score of 90.3%.
What was your last step and what type of an experiment was it?
By 4/13, we will conduct a 24-hour experiment where all ED lab specimens will be sent from the west tube station number 48 to the lab station 49. If the tube system goes down, then labs are to be walked. This is a hypothesis, testing the hypothesis experiment.
What obstacles do you think are now preventing you from reaching the target condition?
We do not know if the extension set available within the ER affects hemolysis. We do not know if the blue transfer device currently being used is contributing negatively to hemolysis. We do not know if the ED team universally knows the best equipment to use when transfer devices are unavailable. ED team members are not using standardized technique when collecting blood and tube station.
Sounds like you need some more facts, data, information.
The tube station, we talked to plant ops about it, and that they showed us that the tube station, when it goes from one zone to another, is going like 30 to 45 miles an hour. And when it goes from one zone to another, then it ends up hitting a wall, starting a lot, so it's shaping up the tubes often. So especially with what our results were from our last step, it shows that the tube station has a negative effect on hemolysis, it's increasing it.
All right, can you take your obstacle parking lot down and let's write that obstacle and fact, data, and negative outcomes and how you just described it?
So we do not know the methods to universally combat the negative effects the tube station going 30 to 40 miles an hour has on hemolysis.
Which one obstacle are you addressing now?
We're going to flag the one that we just were dealing with because there's another obstacle we thought we had completed that's come back into play due to BareCore having a new tube. So those obstacles that we thought we finished were we do not know if the light green tubes are affecting hemolysis, and we do not know if the dark green tubes would reduce hemolysis. So combining those a little bit, we do not know the optimal chemistry tube to use for hemolysis reduction. So our process characteristic is the optimal chemistry tube. So this would help us achieve our process characteristic, target condition, optimal chemistry tubes.
What is your next step?
So the next step is going to be by 4/17, we will invite BD reps to come to the tea times at 14:45 and 18:45 to talk about validating BareCore tubes on night shift rather than waiting to start Tuesday morning on day shift. We originally had planned to do it on a day shift, but we got such good buy-in, I think, on night shift that we asked that they kind of hold off on that.
What do you expect?
We think that they'll be able to do it, to attend those shifts and change the validation time frame because they'll be in town at 1:30 p.m. We also think the night shift will have more buy-in validating those tubes according to the way that they've done experiments with us in the past.
When can we go ahead and see what we have learned from taking that step?
Tomorrow.